I have officially done a declaration of emergency, which gives us certain powers. So we're doing more tests. The more tests, the better. The more positives you find, the better, because then you can isolate them and you slow the spread.
Good evening and welcome to Metro Focus. I'm Jenna Flanagan. New York is on high alert tonight as the number of coronavirus cases continues to surge. Over the weekend, Governor Andrew Cuomo declared a state of emergency to boost efforts to fight the outbreak, which had infected over 100 people in the state as of Monday morning. New cases have been reported in the Bronx and Queens, and also in New Jersey and Connecticut. Nationwide, the death toll reportedly stands at least 22, with over 550 cases across the country. Confusion and anxiety about the virus have also spread to Wall Street, where today, the New York Stock Exchange temporarily halted trading as stocks plunged amid fears about the coronavirus and uncertainty over falling oil prices. Amid conflicting information and confusion surrounding the outbreak, we're joined by a doctor who is no stranger to viruses similar to this one. Dr. Barb Arnott is an award-winning journalist, best-selling author, and infectious disease specialist who worked on the Ebola crisis. So first, thank you so much for joining me on the program.
Oh, you're so welcome, Jenna. Delighted to be here.
Absolutely. So first, I want to start off with New York State has declared a state of emergency. And I sort of wanted to get a better understanding of what does that mean in terms of the state and, more importantly, New York City's ability to be able to address some of the fears and the concerns around COVID-19.
So the big thing is freeing up funds. You're going to have funds for testing, hopefully funds for emergency training, funds maybe to get more ICUs and ICU beds online. The downside of the New York Civil Liberties Union has talked about, of course, is that it does give the governor draconian powers. You know, we talk about quarantine and asking you to stay home and closing your school, closing off streets, closing off communities. We've seen what's happened in Italy with just abject panic as you had 16 million people basically, shut down in a part of the country, and they try to get out by, plane and train and car. So the concern is that it does give him a lot of powers. And this is a tough situation. This is not China. When it comes down to shutting down a whole district, Americans are going to want to push back. So, there'll be some very, very hard questions that'll be asked.
Speaking of hard questions, there's also confusion over getting correct information and answers. For example, we recently got some information from Mayor de Blasio. He was saying that, quote,
"What if someone sneezed on a countertop? The disease doesn't last long, literally minutes, and it's gone." I asked earlier, what if someone sneezed into someone's drinking water? It doesn't transmit through anything you ingest. What if someone sneezed on your soup? It does not transmit through something you ingest. It has to come in mouth, nose, eyes, through directly breathing it in, directly breathing in someone's sneeze or cough or spit.
Now, we've heard from some other officials that might not necessarily be the case. Do we know where the mayor is getting his information from, and who is it that we trust?
So the great news in the United States is that the CDC really is the finest disease surveillance organization in the world. They've been active in China and are been asked to participate in Iran and Italy and whatnot. They are the very best. And Tony Fauci is the head of the NIAID, is simply the finest infectious disease expert around. I worked with him since early HIV and Ebola and cholera in the Congo. So it's a really good team. And I think if you go to the CDC website, they're going to be straight. They're going to give you the straight answers. When politicians get involved here, they can vamp a little bit. What we know is that these diseases can be largely, a droplet in the air that kind of comes at you, or can be a droplet that settles onto something. And there's a differential as to how much of a disease is spread one way versus the other. Right now, we don't know. We do know it's a mix. So the most important thing is going to be the distancing. They talked about, in terms of misinformation, using an elbow to sort of, handshake. Now the World Health Organization says this morning that's not a good idea. And the reason is you want that 6-foot distance. And if you come close enough to use an elbow or a fist bump, it's really too close. So remember that It's going to be the aerosol. It's going to be somebody coughing, the disease going through the air that would be the predominant means of spread. Secondary, that would be surfaces. And although you can wash your tabletop as much as you want, the iPhone, they think it may, and there's no proof of this yet, they think it may last up to a week on an iPhone. An iPhone is, or an Android, is sort of a disease breeding petri dish, an elevator button, the doorknob. If you're going to wash your hands, the doorknob going into the bathroom, the faucet. Those are all places that diseases breed. So, we don't know how much of the spread right now is that, and that's why they talk about the hand washing. But, the primary means of stopping the spread of the disease is the distancing, which means that you're not on long haul airlines, you're not on a cruise ship, you're not going to a big meeting. And what's tough, I'm up here in Vermont where people joke that we self-quarantine all the time because we're out alone in the woods. But in New York City, it's tough because if you're on a subway and your bus, you just, you've got that distance. So I think one thing you can do in New York is, if you have the time and if you don't live too far away from work, that, you walk to and from work, you try to avoid the buses and the subways, if that's at all possible.
I guess, is there anything else to sort of keep in mind? Because someone could have it, have absolutely no idea that they have it. Someone could have it and be very symptomatic of having it. Is there anything else that we should be doing?
So what's interesting about this, Jenny, is that there is a differential in terms of how likely you are to spread in terms of basically, breeding the virus in your body. So if you're very, very sick, you're breeding a lot more of the virus. If you're not ill and not symptomatic, you're a lot less likely to breed. The key thing, though, is if you have a telltale trace. For instance, I trained actually up at Dartmouth, which is a wonderful medical center. It's where I get all my medical care. But as you read over the weekend, there was an individual who had come back from an area, who had been warned, had been told to self-quarantine, didn't, went to a party where there were medical students and other medical professionals. And then those individuals went on to other parties and fraternities at Dartmouth over the weekend. So you can see how if somebody doesn't play by the rules and knows that they have been exposed and have been told to self-quarantine, doesn't. And this is tough because, it's the real responsibility is on the individual who does have a cough, does have a fever, does feel like they're starting to get sick. To your point, though, it seems as if there's sort of an early phase of the disease where you may have a cough, a little bit of fever, and then it gets progressively worse to what they call a tipping point. That is, for older individuals in their 70s and 80s, when they get sick, they suddenly get very, very ill. So one thing that the CDC is doing is they're very careful about tracing. That someone gets off a ship, they go onto an airplane, then they go to an Air Force base. They're tracking every last little step. And it's this contact case tracing that's one of the primary protective strategies in terms of keeping us safe.
There's been a lot of people who have sort of medical historians, if you will, who have sort of tried to look back at previous pandemics, for example, the flu, the infamous flu of, I believe, 1918, 1919, and sort of tried to see what we could learn from those incidents. Is there anything that you think that we should definitely be taking away from how those incidents of infectious disease were handled versus now?
So it's really interesting, of course, the 1918 flu, it's the end of World War I. Both sides knew that they had this flu, but they didn't disseminate the information because they didn't want to give away they had a vulnerability. So even then you had governments interfering with the proper dissemination of information. Now, because the Spanish weren't at war, they reported it, and so they call it the Spanish flu, not because it emanated from or originated in Spain, but because they fairly reported on it, and it looked like it was coming from there just because that they were straight up in the media. I was at an Ebola epidemic a few years ago in northern Uganda, which is a truly terrifying epidemic. People put this all into perspective. The real risk worldwide is what we call these hemorrhagic fevers like Ebola, where people are, bleeding and their immune systems are falling apart. Corona is nowhere near that. This is a simple respiratory virus, obviously, more serious than the flu, and that you potentially could get sicker, probably a little bit more infectious, higher death rate from what we see right now. But this is not a terrible epidemic like Ebola. But in that particular epidemic, what they did is they had helicopters ready. to find anybody in the country immediately and take them and put in isolation. So it emphasizes that regardless of the severity of the epidemic, that being able to take those individuals, put them into isolation, use very careful contact tracing. Who did you talk to? Where did you go to dinner? Who are you in the elevator with? Is the primary means of trying to control the epidemic when it's very early like this.
My final question is that, and it seems like there's so many different effects that the coronavirus is having, and one of them is that could this be causing a global recession? Now, so many things that we've all found out that we use in our daily lives, from cars to antibacterial wipes to our medicine, is all tied back to China. And of course, with China locking so much down, that we're seeing perhaps a disruption in the supply chain. As well, I can't say as a result, but one of the things that we've also seen is significant falls in stock prices. This is continuing to happen even today. What would you say about that?
Look, I think the biggest outcome for most people is going to be disruption. You know, their kids' school may be closed, so they have to stay home. Their own job, may ask them to stay home. Of course, through the service industry, you may find that, there are fewer restaurants are open. You may have quarantine that shuts down all local businesses. You have the supply chain where a lot of companies in the United States are now starting to struggle because they're not getting those parts from China. Apple Computer is an example. Not only losing sales in China of their iPhones, but just, falling way behind. So I think the important thing to say in terms of a recession, sure, it could trigger one, but this should be relatively short term. You're going to have this, it'll spike whenever it spikes, fall off as the spring goes on, and then people will be back to work. But immediately look at, you have Lufthansa stopping all its 380 Airbuses. You have major airlines cutting routes. You have, the cruise industry now being told that people shouldn't take cruises. So there'll be a lot of financial disruption, but it is relatively short term. And, one would hope that the economy would be robust enough. The other thing I would say, Jenna, is that to consider is that in England, the most troubling thing is rationing. That is, if you're older and they become truly overwhelmed, you come in, then they just say, we're not going to treat you. And if you look at the numbers in the United States, we have roughly 100,000 ICU beds. Well, if you do the math, if you have 1 million people that are infected, you have 150,000 people that are seriously ill, you overwhelm the country's capabilities to be able to treat it. So I think that when people worry, they worry for a good reason, and that is when you do reach large levels, then you do run out of services. And I think that's why people are a little bit panicked. What I would say in terms of reassurance is we have very few cases so far. I think we've done a pretty good job in terms of limiting the number of cases, especially compared to Italy, Iran, Saudi Arabia, and China. And we do have the very best team with the CDC and with Tony Fauci. So we're in good hands, but I would say that, the public's stuck in a tough place, which is that public health authorities always want to damp down the expectation and the fear. They want to calm people, and the press wants to responsibly report it. And so they're sort of caught between the two. And what I would say is, pay attention to your family, have a plan, know what medical center you're going to go to, be in contact with your doctor, and just be very early and very proactive at the very first symptoms of any kind of a respiratory or head cold-like disease, and report those in as quickly as you can.
Of course. And it seems like from our conversation, your biggest takeaway is check the CDC website.
They're the most reliable, the most accurate worldwide. They've done a great job so far, and they're going to be completely straight up in terms of, what to be fearful of and not to be fearful of.
All right. Well, that's very helpful, considering how many perhaps miscommunications and misinformation and stuff that's all over the place on social media within conversations. There's a place where you can go.
But Jen, it's a great opportunity to grandstand. I don't think there's a politician now that doesn't want to get out there and have a press conference. It's a great time to get some face time and sort of, be in charge. So what I would say is take a big step back from the politicians, regardless of the party, and look at the Centers for Disease Control. They're going to give you great information. They work with your local state authorities, And it's to their advantage to be as straight up as they possibly can, telling you what you should be worried about and what you shouldn't be worried about. And, for the vast majority of the American public, this is a very mild illness. If you're a child, you may not get it at all. In your 20s, 30s, 40s, 50s, you're probably fine if you don't have any kind of, chronic illness. And you know what? One of the best pieces of information I think to be disseminated is look at, if you're a teen and you're vaping, don't. If you smoke, don't. If your diabetes is out of control, pull it back into control. If you have asthma, as you can hear I do a little bit, get it completely under control. Now's the time to look at those chronic risk factors and rein them in so that you're ready.
All right. Well, listen, thank you so much for joining us and giving us some much needed perspective, because I feel as though we all need that right now.
Great. Thanks, Jenna. Great service.
Thank you.